Welcome. So today we're going to do our case study on C-section. So this is the cesarean section case study. So what does the image show? So this image show delivery of a fetus with cord around the neck via the transabdominal route, which is the cesarean section. That's what it shows. Then what's the type of incision? So as you said, this is the cesarean section. So the incision made on the uterus is called the fan steel incision. So let's start by reading all the questions. So what could have caused fetal distress in this pregnancy? Give 3 indications for recurrent operations. Give 2 intra-op and 2 post-op operative complications. So you have already answered A and B. So let's go now to C. Okay, so on part C, we could say this is what could have caused this fetal distress in this pregnancy. So I already said on what I have seen. So I've seen the cord around the neck. So that's most likely the common cause of the fetal distress in this pregnancy. So that was the cord around the neck. Then give 3 indications for recurrent operations. So indications for recurrent operations for someone to go back for a cesarean section when they are already a previous Caesar. So you can have, if they underwent a classical cesarean section, that's one. If there are 2 previous Caesars, meaning the 2 previous lower segment cesarean section, that's definitely an indication for a recurrent operation. Definitely they have to be taken to a C-section. Then the other indication is a contracted pelvis. Then the other, if they just continue to have recurrent preeclampsia, eclampsia, those conditions, then placenta previa, those are some of the conditions for recurrent operations. Then give 2 intra-op. So we are now on intra-op and 2 post-operative complications. So intra-op, we can have shock, hemorrhage, injury to the adjacent surrounding organs as the bladder, ureter. Then post-operative complications, the 2 post-operative complications, you can have infection, also PPH can also occur. Then those are some of the post-op complications of a cesarean section. Then the other post-operative complications, we can have puerperal sepsis, wound hematoma, wound dehiscency. Those are some of the other complications, post-op complications. Then this is a case study for a cesarean section. So you might be asked to name the layers of the anterior abdominal wall. So on the layers of the anterior abdominal wall, so we can have the first part, which is the skin, and then second first layer of the superficial fascia, which is known as the carpus fascia. Then 3, we can have membranous layer of superficial fascia, which is the carpus fascia. Then 4, we can have external oblique muscle. 5, internal oblique muscle. 6, transversus abdominis muscle. Then 7, fascia transversalis. Then 8, extraperitoneal tissue. Then 9, we can have parietal layer of the peritoneum. Then if maybe they were asked to define what you have seen, to define the C-section, you can say this is an operation that is performed to deliver a baby via the transabdominal route. So those are some of the things. Then types of C-section, can classify C-section according to the timing. So we can have elective and emergency. So elective or scheduled C-section are done at a pre-selected time. So meaning they are elective. So they are done at a pre-selected time before labor, usually after the patient is now become term. Then emergency, as the name suggests, emergency, so we haven't planned for it. Then you can also classify it according to the site of uterine incisions. So for example, what this type of uterine incision was the lower segment cesarean section. Was fan steel. But when you say in terms of when you are making when you make that first incision, let's say you are doing it on the upper segment, yeah, it's going to be called a classical C-section. Then on the lower segment, it's going to be a lower segment C-section. Now, a lower segment can be also a transverse or vertical. So that's that. If you classify it according to the site of uterine incision, then if you classify it according to the number of procedures, so according to the number of procedures, we can have primary C-section, meaning for the first time, then a repeated C-section. So those are some of the things you need to know about a C-section. Then in terms of indications for elective C-sections, we can have elective C-section. You can do when someone comes with a macrosomic baby, you can just do elective, so meaning they came before the time of their term, so you can know, okay, this one we will just plan for a C-section. Then the other is a repeated C-section. When you know someone has a 2 previous Caesar, you can cancel them to come for another C-section. Then uterine surgeries, if they underwent uterine surgery such as a myomectomy, you can have malpresentation, breech, transverse lie. Those are some of the indications for a planned C-section. Multiple pregnancy, placenta previa, infections such as HIV, active genital herpes. So, but these are indications for a planned, but they are not absolute. And then cervical cancer, full thickness, non-transverse incisions through the myomectrum. So this one is probably an absolute indication. Severe IUGR are some of the indications for an elective. Then for emergency, so we are now on emergency. So for emergency complications, emergency indications, you can have maternal distress or fetal distress, which is the most common, uterine rupture, vasa previa, severe preeclampsia, severe abruptio placenta, cord prolapse, obstructed labor, and other malpresentations that may occur during delivery. And then you can also classify the indications as, like I said, absolute or relative. So that's some of the things you need to know on cesarean section. Then you also need to know the advantages between the advantage and disadvantage between a lower segment transverse and also a classical C-section. So that's what you also need to know. So for lower segments cesarean section, advantages is that there is reduced blood loss, reduced risk of adhesions, and the vaginal birth after cesarean section is okay. Then the disadvantages is that there is risk of bladder injury. Lower uterine segment must be formed, so you should know when the lower segment must be formed. So it's usually formed after 32 weeks of pregnancy. So meaning before 32 weeks, then it's not there. So that's a disadvantage. Then delivery should be longitudinal only. Then for a classical C-section, advantage is that the fetus can be delivered regardless of orientation in uterus or gestation age. Disadvantages are that there is increased blood loss, there is increased risk of adhesions, then vaginal birth is not safe, so the VBAC is not safe, then there is a high risk of uterine rupture. So then the contraindications of you doing a C-section are DIC. So we are now on contraindications. So contraindications: DIC, extensive scar or pyogenic infection on the abdomen, or in the case of burns, can have a dead fetus in CPD, neglected shoulder. So you can choose to not allow the mother to go through the pain, the risk of having a scar for a dead fetus. So those are some of the things you need to know about a C-section.